Okay, so before I go into the patient's room, I would check their chart. I see that they have an order for a nasogastric tube placement because this patient has Crohn's disease and a bowel obstruction. So the nasogastric tube will help alleviate that, and there's also suction, so I'll be showing that at the end part of the video. So as soon as we come in, provide privacy. Come over here, do hand hygiene. Hello, Mr. Neem. My name's Elizabeth. I'll be your nurse today. Can you verify your date of birth and name for me, please? And then patient verifies. I'm gonna lift you up a little bit in bed. How are you feeling today? Patient says they're uncomfortable. So your doctor ordered a nasogastric tube for you. I know you have some obstruction in your bowel right now due to your Crohn's disease. So I'm just gonna place that in for you today. It's not the most comfortable procedure, but I have an assistant here who's gonna help me with it today, okay? So first, let's just, gonna check your nose. And have you had any surgeries on your nose, or do you have a deviated septum? No? Okay. I also saw on your chart that you're allergic to silk tape. We do have tape with us today, but it's not silk. Do you have any other allergies? Patient states no. And, all right, let's sit them up. So I'm gonna sit you up to a high Fowler's, about 45 degrees. Okay. So I'm gonna drape you over with the towel. This just help protect your clothes. And I'm gonna check for your gag reflex. We're gonna be placing a tube through your nose and down your esophagus or your throat, down to your stomach. So we're just gonna check to see what a natural gag reflex is. So put that on your tongue, look down, and even I can look in there with my light. The patient does have a gag reflex, so it's something to be aware of. So now I'm gonna get my tape ready. One is gonna be an indicator that I'm gonna place on the tube once I measure it to see approximately where I should stop. So that's one for the tube. And then one this is gonna be to secure it to the patient's nose. So I'm actually gonna do this one in a chevron, which is ripping it in half, about halfway. That's good. Okay. Now I have my supplies here. I will put the basin right here to start. So I'm going to take out my tube and open that up. Okay. Just going to stretch a little bit. And then I'm going to take this off. And before I would have started, I would have made sure that the table is cleaned off from any personal belongings and that I disinfected it. So now to measure, I'm going to go from the tip of the nose to the earlobe, and then from the earlobe to the xiphoid process, and then just a bit down. So I'm going to have that. I'm going to put my tape on it. I'm going to put my tape on it. Okay. I'm going to put gloves on. All right, Mr. Tran, how are you feeling? Says he's feeling okay, not very nervous. So I have an assistant here that's gonna help me with holding this for you. It just has water in there. So what I want you to do is just take sips of it throughout the procedure. So when I start going in through your nose, you could just start taking sips and sips and sips. And if at any point you feel like you need me to stop, you can, we can come up with some kind of a signal or something, because I don't think you're gonna be able to talk. So we would discuss that. Maybe it's this, whatever they decide. Okay, so now I have my tube that has a marker on it. My patient is educated and ready to go. I'm going to lubricate. Okay. I'm going to attach this to the end of the tube so that it can collect any aspirate that comes out, so we can immediately test it to see that are we in the stomach or not. I'm going to put that in the basin in case there's a lot that comes out. And we're just going to get started. So at first, I'm going to have the patient tilt their head back into the pillow and take a sip. So they're taking sips, 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 sips. And then once I feel some resistance, I'm going to ask them to lift their head forward. So, all right, you're doing a good job. Okay. I'm rotating it. If I were to rotate it and it does not keep going, I would probably stop, because that's an indication that it is curling up in their throat. So if you feel the need to gag, that's completely normal. Just please keep taking sips, but if it happens too much, that's an indication that I went into the wrong tube, that I'm in the lungs, and I would stop the procedure. So. Okay. All right. Did a good job. So we do have some aspirate here. It's green. That's a good sign. I'm going to take it and test it with my pH test strips. So here's my pH box. And then it looks like the pH is acidic, lower than 5, which is an indicator that it's in the stomach. Okay, so now we would send him off for x-ray. Put this tape on. Take this tube off. Okay. So I take my gloves off. I do hand hygiene. I would put new gloves on and do mouth care. And so I go to the MAR or to the MAR, and I see that the order came back for, or that he came back from the x-ray, and it is in the stomach, and he has a prescription for intermittent low. So I turn that on intermittent, and I made sure that it's working. And then, so I turn that on first, and then I'm gonna get my attachment piece, put that in there, and then attach it. All right. Do you need to go to the bathroom? Are you in any pain? Patient states no. I would document everything that happened today, how the patient tolerated it, the units that they're on, and yeah.